Studying history from the perspective of different racial and ethnic groups reshapes who we think of as American, reshapes how people see themselves as part of America, and therefore allows them to imagine that they may be part of its future. I'm Natalia Molina. I'm a historian. I focus on the stories and the policies we craft around race. I was always fascinated by the fact that certain groups were seen as able to assimilate while others were not. Why are some people accepted as American more readily than others? My book, How Race is Made in America: Immigration, Citizenship, and the Historical Power of Racial Scripts, examines how we came to understand race during the 20th century and how these categories are still with us today. I coined the term racial scripts to show that our understandings of race in America, such as black and white binary, influenced the way that we weighed different immigrants coming into the United States. And so I started to trace the policies of what set these groups on different paths. Science, health professionals, health officials, all informed our ideas about race. When we look at Los Angeles today, we can trace the impact of these policies. I grew up in a neighborhood in Los Angeles called Echo Park. Vietnamese refugees, Chinese immigrants, Filipinos, Irish, working class whites. I'm currently working on a book entitled Placemakers, which looks at Mexican restaurants and Mexican workers in Los Angeles' Echo Park neighborhood. My grandmother, Natalia Molina, established the first of these restaurants, the Nayarit. There are no archives to tell this story. This is truly a book based on underdocumented populations. It looks at the ways in which Mexican immigrants, especially Mexican women, were key in establishing restaurants that served as what I call urban anchors, cultural crossroads that allowed people to form bonds across the color line, feel that they truly were part of America without necessarily having to give up their own culture and identity. Immigrants don't live separate lives than us. They're in our communities. They're the ones taking care of our children, putting food on our tables. We expect them to do the labor, but are not willing to offer them any kind of safety net or social benefits. To undermine their health is to undermine the public's health. We need to be comfortable with seeing different perspectives on the past. If we understand the many historical factors that shaped where we are today, then we have the power to reimagine where we can go from here.